Good afternoon, my name is SGomes and I will be performing my O2 video for nasal cannula, simple mask, and non-rebreather. Prior to entering the patient's room, I have closed the curtain for privacy. Now I will be performing hand hygiene and putting on PPE and introduce myself to the patient. Good afternoon, sir. My name is SGomes and I'll be your nurse today. May I please have your name and date of birth? I will confirm his name and date of birth from what he said to his bracelet and then against the orders that I have. Now I will explain to the patient the procedure. Today we're going to put on nasal cannula to help you breathe better and raise your O2 levels. I will make sure the cannula is hooked up to the oxygen. Cannulas can go from 1 to 6 liters per minute. I have an order for 4. So I will raise it until the ball hits at the 4 mark. I will check this for airflow, which is flowing excellent. Prior to entering this, I'm checking the nares to make sure there's no irritation and nothing that would prevent or cause any issues. I will carefully insert it, wrap it around the patient's ears. Tighten it. Sir, how does that feel? Good. I would now have him breathe through his nose to assess to make sure that there is nothing going on and he can breathe fine without having his mouth open. Everything seems to be in order. And if there was any skin irritation, I would put gauze on around where the tubing is to alleviate some of the irritation. In about 8 hours, I would change the tubing when necessary, and I would assess all of his respiratory, making sure his lungs sound fine, recheck his O2 level, and to make sure everything's progressing normally and in the right direction. Now, I'll demonstrate the simple mask by turning this off, removing the nasal cannula, and grabbing the simple mask. So the simple mask is for higher volume oxygen. It would be from 6 to 12. If I had an order for 10, let's say, I would attach it and check to see if airflow is coming through, which it would be, and carefully wrap it around the patient's head. Have it sit snugly around the nose and the mouth. This mask is a little bit too big for my patient here, but for demonstration purpose, it's fine. You would make sure it would sit snug against the chin, and you would be able to pinch the bridge of the nose so it sits flush against the face. You can adjust with the straps to pull it in tight. You would come back every 2 to 3 hours to assess the skin to make sure there is no moisture collecting, no skin breakdown. If there is, pat it dry. Make sure you don't use any powders because that can disrupt the breathing. And you would reassess all of the respiratory vitals again to make sure the patient's progressing in the right direction. The final mask I will be demonstrating will be the non-rebreather, sorry. This mask is a little bit different because it has the reservoir. This one I will plug in to demonstrate. You will want to make sure the bag is filled. These are used for 10 to 15 liters of oxygen. I'll demonstrate it with 12. So I would bring the ball to 12. One, you would check to make sure the air is coming through and make sure the bag is filled before you prior to putting it on the patient. Once again, this goes on very much so like the other masks. Go around the forehead. You would also make sure the mask fits snugly against the patient's face. Once again, this mask is a little too big for my patient, but for demonstration purposes, it works. And you would pull tight and to make sure everything is situated correctly. Once again, you would reassess the patient's respiratory and making sure the patient is progressing in the right direction. And you would also check the mask for moisture every 2 to 3 hours. And that concludes my video.